So I decided it might be a good idea to walk you through how to fill out a nursing brain. And I know that might seem like a really simple task, and it's very individual to the nurse and the brain that you're using. But what I can do is show you how I organize my work, because it really helps me organize my day. If I lose my brains, or if I end up not having the brain that I'm used to using and I use a different one in its place, it really throws me off for the entire day. And time management and staying organized can sometimes be the biggest challenge in any nurse's day. So I'm going to just kind of walk through how I fill out my brains, and I hope that it helps you as you try to choose which brain that you want to use, and how you fill things out. So if I were to be, so I'm going to walk you through my brain. I want to have my room number. I want to know when that patient was admitted, because I want to know how long that they've been here, because someone's going to ask me that question. Patient's name, their age, their code status. I want to know which doctor is caring for them. I want to know what their primary diagnosis is, and I want to know their history. And I'm going to put significant things. If they're there for a stroke, I don't care if they had gout, probably. I want to know what their diet is, and I want to know their activity level. How do they get up? I'm going to write down any IV access, peripheral IV lines, PICC lines, central lines, if they have any IV fluids going. I'm going to make some quick notes. What I like to do is when I get report, I write down any assessment information that I'm given in report. And I like to use these multicolored ink pens, because I can put the assessment information that I got in report in one color, and then if I want to add to it or something changed, I can write it in another color, and I know that that's my information for today. So neuro, respiratory, cardiac, I'm going to circle this if they're on telemetry. Their musculoskeletal, GU, so their urinary, their GI, and their skin. I'm going to write any significant labs in this space. I'm going to write INOs, and I'm going to write all my medications here. I like to put a separate little area for pain meds, because I want to know what they take for pain, and I'm going to write down the last time that they had pain medication. I'm going to put their vital signs here, and then any notes down here. I like to keep track of what I've done and what I still have to do for the day. So under charting, I'm going to circle it when I'm done with my assessment. I'm going to circle this when I've charted in my care plan, and I'm going to circle education when I've finished my patient's education and charted it. And then this is CM, this is for case manager, so I'm going to want to know who the discharge planner is going to be for the day. So if I were to be getting a report, I have a patient in room 2001. They were admitted on 10/10/15. Their name is John Doe. John is a 55-year-old male. He's a full code. I like to write my code status in a different color. And he came in with some shortness of breath. I like to know what the symptoms were when they came in. Admit for SOB. They did a chest x-ray, and they found that he had pneumonia. He has a history of hypertension, and he also does have a history of pneumonia. So he is a standby assist with a front wheel walker, because he was having some dizziness. He's on a general diet. He has a 20 gauge in his left AC, and he has normal saline running at 100. This patient is alert and oriented, although sometimes he can be a little bit forgetful. He's on 2 liters of oxygen currently, and his lung sounds are clear on the left, but he's got a little bit of crackles on the right bases. Okay? And again, this is everything I'm getting from report. The patient is on telemetry. He's normal sinus rhythm in the 60s. nothing to chart here. He's urinating fine. His last bowel movement was yesterday, before I'm sorry, it was on the 9th, just before he came into the hospital, and his last stool was loose. Excuse my dog barking in the background. He doesn't have any skin issues. So and also I want to know that he lives at home with his wife, and when he's discharged, he'll be discharging home with his spouse. So once I get report and ask whatever questions I need to ask, I can also, well, that's about the basic information that I'm going to get in a report. Report should be concise, to the point. The oncoming nurse can look at the assessment. You don't need to go through every little thing. It's basically a summary of how they did. And so once I get a report on my patient, what I'm going to want to do is go to the computer. And the first thing I'm going to want to look at is the orders. So when I get into Epic and I look at the orders, I see that the patient is a daily weight. I see that he's on strict INOs. And I'm confirming that he's on Tele. I also saw, which I didn't get in a report, that he should have scuds on. So I'm going to write that there. And that they are giving him Zosyn for his pneumonia. Just making this up as I go here. So I've looked at all the orders and I know that I have all the correct information. The next thing I'm going to look at is the labs. And I'm going to look at this morning's labs, and I see that his sodium was a little low and his potassium was a little high, and his WBCs were also a bit high, and all the other labs that I see were normal. I do see that they forgot to tell me he was diabetic, so he's diabetic, and that he's a blood sugar, so I'm going to want to make sure that I'm doing blood sugars, and I write ACHS here. And I can look at his glucose for this morning was, let's say, 110. So he was good with his morning glucose. So the next thing, after I look at the orders and then I've looked at their labs and made a note of any labs that are out of the ordinary or that are pertinent to that patient, then I'm going to want to look at the work list, and that's where I'm going to look at what meds are due. Okay, so I see that he has 8 o'clock insulin, and that would be sliding scale, so depending on what his morning blood glucose is, I'll decide whether I'm going to be giving him any insulin. And then at 9 o'clock, he has Zosyn due. He also has a lisinopril, and he's got some Protonix. And then that's it for his 9 o'clock med, so that's not too bad. And then again at 1400 he has another dose of Zosyn. And then at 1800 he's got another dose of lisinopril. So, didn't spell that right. So I like to write down my med times, and then as I'm giving the meds, I cross them off. If it's something that was ordered but I didn't give, like say his blood sugar was fine, it was less than 150 and I don't need to give a sliding scale, then I mark it off in a different color. That's just my way of telling me that I've addressed it, I've charted that it wasn't given. If it was something that ended up being later discontinued, I would just cross it off my list. Okay. I also, when I was looking at his orders or his meds, I did see that he had pain medicine. Every once in a while he'll complain of some back pain. So he does have Norco. It's 1 to 2 tablets, and he can have it every 4 hours. And the last time he had it was 2100 last night. So I know that when I go in and say good morning, if he says, oh, I'm doing great, but my back is hurting, I'll let him know, well, last time you had any pain medicine was last night, so I'll make sure to bring you a pain pill with your morning meds. Okay? So once I get all the information that I need out of the computer, then the next thing I'm going to do is go and find out I'm going to look at the hospitalist list and find out who my doctor is for the day. So I see that Dr. Khan is my doctor. And I also look at the case manager list and I can see that Cindy is going to be the discharge planner. So that's important to know for patients that may need some discharge planning. This patient is probably going to be pretty simple. He's being discharged home with his wife. So once I get my report, I go to the computer, I look at my orders, I get my labs, I get my meds, and then I find out who the doctor is, and I find out who the case manager is. By the time I'm done with all of this for all of my patients, this should be finished by 8 o'clock. So at 8 o'clock, I should be ready to walk into the room and say, "Hi, good morning, my name is Teresa. I'm going to be your nurse for today. I'm going to be back shortly with your morning medications and to do my assessment, but I wanted to introduce myself and see how you were doing if you needed anything." And they might say that at that time, "Oh, my back's hurting," whatever, okay? You want to use the information that you've now gathered from the chart to update your whiteboard. The CNAs will usually update the date and things like that. You want to make sure that the doctor's name is on the board, that your name as the nurse is on the board. You want to make sure that the mobility is noted on the whiteboard, their code status, and their diet. And then, if they're hard of hearing, if they've got dentures, if they've got hearing aids, all those kinds of things. So those are things you just take a quick look at the whiteboard, update it if needed, and then you're out of the room. Since you're going to be doing total patient care, at that point, you're probably, once you say good morning to your couple patients, you're going to come back around and get their vitals, and you're going to put their vitals there. So when we come back, we see that he is afebrile. His blood pressure is good. His heart rate is great, a little higher than it was before. His respirations are fine, and he's at 95% on 2 liters of oxygen. So now I know that I can give my blood pressure medications. I checked his blood sugar while I was getting vitals since he was awake, and he was at 104, so I don't need to give the insulin. And so once I get the vitals, then I'll come back around and grab all the morning meds, look at orders again to make sure nothing's changed within that last even 45 minutes, because that's the time when the doctors are just coming in and they're going to be looking at all the charts and maybe making some adjustments. So I'm going to be going in and giving morning meds. Now, one thing that I'm going to want to address with this patient is the fact that he's got a 5.0 potassium. That's going to be something that the doctor needs to know about. As a student, you're going to be working with your staff nurse to make sure that somebody has noticed this and that the doctor's been notified. They may or may not do anything about it, but you're going to notify them, and you're going to document that the doctor was notified. I like to do my assessments in the room, and when I've done my assessment and I'm done charting it, I'm going to circle this. So that's kind of the basic morning routine. I hope that that's helpful in helping you guys kind of manage your mornings. If you can get off to a good start, that can really set you up for a good day. Also, really utilizing your brain in an organized way, so that if while you're doing this with this patient all of a sudden something's crashing or their blood sugar is 20 and you need to go address that you can come back here and you know where you left off. And if you do it the same way every day, if you don't see any labs here after you've had to run out and go to another room, then you're going to come back to, I got to make sure I get my labs done. Having a really organized brain and coming up with a system that works for you is really, really important, and it'll set you up for a successful day and keep you on track even when you get pulled off track. Okay, so I hope that's helpful.